Welcome to The Explainer. Today we're diving into something really fascinating and honestly kind of overlooked. We're unpacking how the managed care industry, the companies behind your health insurance, how they are quietly modeling the financial shockwaves of environmental shifts. We usually picture melting ice caps or rising sea levels when we talk about this stuff, but today we're looking at how the shifting environment directly hits human health, and by extension, the massive systems built to insure us against illness. Okay, let's kick things off with a question that takes this giant, abstract, global issue and brings it right down to your wallet. How is your health insurance company preparing for climate change? It might sound like a weird question at first, right? But think about it. When the environment shifts, human health shifts right along with it. And when that happens, the entire mathematical model that insurance companies rely on to set your premiums and cover your medical claims, well, it essentially has to be completely rewritten. So here is our roadmap for today to see exactly how they're doing this. We're going to start with climate change and human health, then move to weather and healthcare encounters, check out the spread of infectious diseases, touch on food and water scarcity, and finally, wrap it up with the impact on managed care. All right, Section 1, Climate Change and Human Health. To really understand this macro trigger, we need to look straight at the official playbook. Specifically, we're pulling from the SASB standards for the healthcare sector, focusing on the managed care standard. Now, these aren't just, theoretical ideas cooked up in a lab somewhere. These are the actual official reporting standards overseen by the International Sustainability Standards Board. It's the exact playbook managed care entities use to disclose sustainability risks to their investors. It's literally how they calculate risk.
And here is where it gets really interesting. Just look at the stark contrast between traditional risk models and these new climate risk models. Traditionally, insurers just looked in the rearview mirror, basing everything on historical data. But the SASB standard explicitly tells them, nope, you have to look ahead. They now have to account for changes in geographical incidence, like where diseases are actually happening. They have to account for changing morbidity, which is the rate of disease, and changing mortality, the rate of death. The past just doesn't predict the future anymore.
Moving right along to Section 2, Weather and Healthcare Encounters. Okay, so think of this like a giant domino effect. Step 1, we see an increase in extreme weather events. And this isn't just about damaged roofs or property loss, it's a physiological trigger. Step 2, we see higher rates of allergic responses, asthma, and heat-induced illnesses, which inevitably knocks over the third domino, increased healthcare encounters. Every single time someone needs an emergency inhaler or a hospital bed for heat stroke or intense allergy treatments, that is a direct healthcare encounter that the managed care system has to process and ultimately pay for.
Which brings us to Section 3, the spread of infectious diseases.
As temperatures and weather patterns shift, habitats shift too. We're seeing the migration of vector-borne diseases. Basically, insects that carry diseases can now survive in brand new areas. This leads to new increased incidences of illnesses like malaria and dengue fever in non-tropical regions. For insurers, this is a massive curveball. It creates a sudden spike in medical claims for newly exposed populations. An insurer who never had to budget a dime for malaria in temperate zones, well, suddenly they have to model for that exact financial risk.
Let's look at Section 4, Food and Water Scarcity. Beyond the weather and the bugs, we have to look at the absolute basics of human survival, water and food. According to the SASB standards, increased natural disasters lead directly to a spike in waterborne diseases, like cholera. Because a flood or a hurricane doesn't just wreck a town, it compromises the clean water systems, keeping everyone healthy, creating these massive, immediate medical emergencies that insurance plans just have to absorb. And on the flip side of that foundational coin, we have food. Decreased food availability, driven by these shifting climates, directly spikes rates of human developmental diseases like malnutrition. And the thing is, this isn't just a quick trip to the ER. This is a chronic, long-term health issue that requires years of extensive medical management and intervention. It significantly drives up the lifetime care costs for an enrollee. All right, let's bring it all home in Section 5, Impact on Managed Care. So how does the industry organize all this? Everything we just talked about falls neatly into specific framework buckets that insurers track. Extreme weather, that covers your asthma, heat illness, and allergies. Infectious disease, that's your malaria, dengue fever, and cholera. Scarcity covers malnutrition and developmental diseases. For a health insurance actuary, they aren't just looking at medical terms here. They are looking at a ledger of incoming liabilities. They have to rigorously assess every single one of these specific health impacts to figure out their future financial exposure. Because these ecological shifts directly trigger human illness, health insurers are facing some very real material implications. The core issue here is just a fundamental increase in encounters with the healthcare system. More sick people simply means more doctor visits and more hospital stays. To survive this, insurers absolutely need to incorporate these new disease incidences into their risk models. And why? Because ultimately, managing these risks is exactly how these publicly traded companies protect their shareholder value. If they get the math wrong and fail to predict these costs, their profit margins completely collapse. And that is exactly why the definitive playbook requires them to put it all out in the open. They are mandated to explicitly discuss any, and I quote, projected impacts on revenue, costs, or plan affordability. They literally cannot ignore a changing climate. They have to tell their investors exactly how much this is going to cost the company, and by extension, how much it's going to cost the people actually buying their insurance plans.
So I want to leave you with this final thought to chew on. As these massive insurance companies calculate the complex, rising costs of a changing planet, from extreme weather, respiratory issues, all the way to migrating tropical diseases, how is that ultimately going to impact the affordability of your own health coverage? Because, when the risk models change, the premiums change. Thanks so much for joining me on this explainer. Keep questioning the data, and we'll catch you next time.